Welcome back to Module 1, the Skeletal System. This mini-lecture covers Topic 1.3, the Appendicular Skeleton, which includes the bones of the limbs and their girdles. Open your workbook to Topic 1.3 and complete the questions as able as we progress through the mini-lecture. The pectoral girdle attaches the upper limb to the skeleton, and the pelvic girdle attaches the lower limbs to the skeleton. What does girdle actually mean? The word girdle refers to the encircling of the body, a ring around the torso. How are the pectoral and pelvic girdles different? The pelvic girdle is designed for stability at the expense of mobility. It is larger, thicker, and sturdier. The pectoral girdle provides mobility at the expense of stability, with smaller bones that move more freely. The pectoral girdle includes the scapula and the clavicle. The scapula articulates with the humerus at the shoulder joint, but is not attached to any bone other than the clavicle. The pectoral girdle is a very mobile region. It is lightweight, and it is not designed for locomotion, so therefore sacrifices some stability for mobility. This mini-lecture on the appendicular skeleton will cover Topic 1.3, Part A, the pectoral girdle and the upper limb. The learning outcomes for this mini-lecture include to be able to describe the composition of the pectoral girdle and its attachment to the axial skeleton. Identify structural features of the scapula. Identify structural features of the clavicle. Identify structural features of the humerus. Identify structural features of the forearm. Identify the carpal bones of the wrist. The pectoral girdle is made up of two bones, the clavicle anteriorly and the scapula posteriorly. Pectoral comes from the Latin word pectoralis. The sternoclavicular joint is the joint of articulation between the sternum on the anterior chest and the clavicle. This is the only point of attachment of the shoulder girdle to the axial skeleton, as posteriorly the two scapula don't join together or attach to the skeleton. The shallow attachment between the humerus and the glenoid cavity of the scapula allows for increased mobility at the shoulder joint. Additionally, the scapula is free to move around the rib cage with arm movement since it has no attachment to the axial skeleton. Overall, mobility at the shoulder sacrifices stability. The clavicle is the S-shaped collarbone. It acts as a brace or a strut to hold the scapula backwards and the arms out to the side. It prevents the shoulder from collapsing forwards. Pectoralis major is a large muscle that spans the anterior chest and is very powerful in pulling the shoulder forward. A fractured clavicle is a common injury in football tackles. If fractured, the entire shoulder region collapses anteriorly. When looking at the clavicle, how can we tell which end is the sternal end and which is the acromial end? The sternal end, which is found more medially located, is cone-shaped or more rounded. The acromial end, which is found more laterally, is flattened. The superior surface of the clavicle is smooth, and the inferior surface is rigid and grooved by muscle and ligament attachments. The scapula is a triangular-shaped bone which lies flat on the dorsal surface of the rib cage. It has three borders: superior, lateral, and medial. In the anterior view, the scapula follows the contours of the thoracic cage. The coracoid process is an attachment point for one of the tendons of the biceps brachii. Try and palpate the coracoid process by finding the clavicle and moving laterally. About 2/3 along the length of the clavicle is the coracoid process, but you'll have to dig deep to find this one. The glenoid cavity is shallow and found laterally, where the scapula articulates with the arm. The subscapular fossa is the shallow anterior surface of the scapula that lies flush against the rib cage. In the posterior view, we have some very prominent features. The spine of the scapula is a raised bar that lies close to the vertebral column at its medial end and flares out into the acromion process laterally. The acromion process articulates with the clavicle at the acromioclavicular joint. In this posterior view, it is also important to note the suprascapulus fossa, meaning above the spine, and the infraspinous fossa, meaning below the spine. These fossae are filled with the rotator cuff muscles that help to stabilize the humerus in its socket. So from which aspect are we viewing the scapula in this image? Let's look once again at the specific features of the scapula, but this time from a very different angle. This image shows the scapula in a lateral view. That is, it's as if you're looking from the outside of the arm through the scapula towards the rib cage. On the left-hand side of each image, we can see the acromion process attached to the spine of the scapula, projecting posteriorly. On the right-hand side of each image, we see the coracoid process projecting anteriorly. This is the very best angle to view the shallow glenoid cavity, the socket of the shoulder joint. Also take note of the 3 fossae. They are named according to their location. All of these bony structures will start to become even more important when we look at the muscles housed within these fossae. The supraspinous fossa, meaning above the spine of the scapula, we find the supraspinatus muscle. In the infraspinous fossa, below the spine of the scapula, we find the infraspinatus muscle. And in the subscapular fossa, meaning underneath the scapula, the surface of the scapula that sits flush against the rib cage, we find the subscapularis muscle. Now we are going to move out of the pectoral girdle and into the upper limb. The first long arm bone we come to is the humerus, otherwise termed the brachium. The humerus attaches to the scapula at the shoulder joint and to the radius and ulna at the elbow joint. We have quite a few features that we need to navigate around, so let's get started. The head of the humerus, the short and narrow anatomical neck, the surgical neck, which is often broken because it is more distal, the greater tubercle, and lesser tubercle. These are separated by the intertubercular groove or sulcus, which is a depression in the humerus that the biceps brachii tendon passes through. The deltoid tuberosity is a raised prominence on the lateral humerus where the deltoid muscle attaches. Moving distally, we draw your attention to the large olecranon fossa, seen in the posterior view on the distal humerus. The olecranon process, more commonly known as the funny bone, is located on the ulnar bone. Try extending or straightening your arm and feel the olecranon process as it slides into the olecranon fossa of the humerus. The medial and lateral epicondyles are distal regions responsible for muscle attachment. The wrist flexor muscles attach to the medial epicondyle. If the wrist flexors are overused, a painful condition around the medial elbow joints results. This is called medial epicondylitis or golfer's elbow. Lateral epicondylitis arises from overloading of the wrist extensor muscles or the gripping muscles. This is commonly known as tennis elbow. Where the humerus meets the forearm at the elbow joint, we see specialized condyles. The capitulum lies laterally on the distal humerus and forms the lateral part of the elbow joint, while the trochlea is located medially. Let's take a look at this test slide where we can revise the features seen on the humerus in the anterior view. Greater tubercle, lesser tubercle, intertubercular sulcus, surgical neck, deltoid tuberosity, lateral epicondyle, medial epicondyle, capitulum, trochlea. In the posterior view, we can see these additional features: head of the humerus, surgical neck, deltoid tuberosity, medial epicondyle, lateral epicondyle, and the olecranon fossa. Well done! You will have more opportunities for labeling diagrams in the tutorial sessions and in your workbook exercises. The forearm of the upper limb is made up of the radius and the ulnar bones. The radius is thin proximally and wider distally near the wrist. The radial head and the radial tuberosity are proximal attachment points of the biceps brachii muscle. The radial styloid process is located distally and can easily be fractured. The radius is concave where it articulates with the wrist. The ulna has a complicated proximal end with its most prominent feature, the olecranon process. This is the prominence you lean on when you rest your elbows on the table or bump your funny bone. The olecranon process forms the elbow joint with the humerus. The ulnar bone is larger proximally and thinner distally. If you palpate all the way down your wrist, you will feel the styloid process of the ulna. It is slightly longer than the styloid process of the radius. In the anatomical position, the ulna is located more medially, and the radius is located more laterally. They are joined by a flat ligament called the interosseous membrane, which tightly binds together the radius and the ulna. Radial rotation allows special movements to occur in the forearm: pronation and supination. Pronation occurs when the distal radius comes across over the top of the ulna and the palm is turned down. Supination occurs when the palm is turned up, as in the anatomical position. Let's try and label this anatomical model. We see the bones of the forearm, the radius, and the ulna in the anatomical position. When the palm is facing to the front, the bones run in parallel. See if you can locate each of the features of the radius and the ulna that we have just described on the screen in front of you. Take your time and remember to pause if necessary. Locate the radius, the radial head, the radial tuberosity, the radial styloid process, the ulna, the olecranon, the ulnar styloid process, and the interosseous membrane. Can you remember which bone the olecranon articulates with? That's right, it's the humerus. The wrist joint is created by the articulation of the radius with the 8 carpal bones. Please don't worry about the details of the carpal bones and their individual names at this stage. Just know the names of the group as a whole and where they are located, which is in the wrist. These carpal bones of the wrist articulate with the 5 metacarpals in the palm. The metacarpals then articulate with the phalanges in each hand, forming the fingers. Each metacarpal has a base that articulates with the carpals of the wrist, and a head that articulates with a phalange. Whilst there are 3 phalanges in each of the digits, 2, 3, 4, and 5, there are only 2 phalanges in the thumb. There are proximal, medial, and distal phalanges in each finger, but only a proximal and distal phalange in the thumb. The joints between the phalanges create the knuckles in the fingers. Let's review the concepts for topic 1.3, the appendicular skeleton, part A, the pectoral girdle, and the upper limb. The upper limb is attached to the axial skeleton by the pectoral girdle. The pectoral girdle is composed of the scapula and the clavicle. The humerus articulates with the shallow glenoid cavity of the scapula. The forearm is composed of the radius, located more laterally, and the ulna, located more medially. The radius articulates with the carpals. The metacarpals form the bones in the palm. The phalanges are the bones located in the fingers, and the joints provide our knuckles. You can see we have now completed the learning outcomes for topic 1.3a, the pectoral girdle and the upper limb, in the appendicular skeleton. We have described the composition of the pectoral girdle and its attachments to the axial skeleton. We have identified the structural features of the scapula. We have identified the structural features of the clavicle. We have identified the structural features of the humerus. We have identified the structural features of the forearm. And we have identified the carpal bones of the wrist. This is the end of the mini lecture for topic 1.3 part A of the appendicular skeleton, the pectoral girdle, and the upper limb.